might want to do it over the plastic. So the idea with this plastic sheet, there's one in the COVID kits right now. It's a really huge thing. Probably what's going to end up happening is you're going to have a smaller size that doesn't cover the patient completely, but just over this apparatus. The lengthwise goes across the patient, so that way it covers everywhere. And the idea is to have this down to the patient. We can still get to the patient if we have to from this direction. You can take the clips, bunch up the sheet on the bed as much as you can, and then clip some, grab some sheet with the bed sheet with the plastic sheet, and it helps just stabilize that side.
One of the things we talked about too is if you don't have clips, we're going to have to restrain that patient anyways. You could tie it down with a restraint.
Right. And then this, and here, I just offset these to get it out of the way of when you go to intubate. Ideally, what would be nice is when you know you're going to intubate this patient, and you're going to be calling the intubation team, or if you're in here and you're going to anticipate intubating, have this on the patient while they're pre-oxygenating. Hopefully it'll minimize the aerosolization that's being produced at that time. If they're on BiPAP, you can put this over them. And then you can gather your supplies up. Ideally you want your glide scope in here, your tube with the stylet, the circuit from the ventilator ready to go. One person will be pushing drugs. The intubator just stays right here. The concept is your hands never have to leave this space. Okay. Hopefully you don't have to, but if you needed a mask, you can mask under this thing, feeling maybe a little bit safer than without this thing on. Once they're intubated, cuff up, circuit on, then you can start thinking about removing this thing. Because this is all contaminated in here, when you unclip the clips, if somebody else could do it, these all have to get wiped down anyways. But and then set it off to the side. Take the plastic. Once you get your clips all done, you wouldn't want to put them by the head of the bed, but if you had a place to set them off, take the plastic, and then you want to keep it as much as you can face down. You don't want to just throw this thing up, because then you're going to spray everything everywhere, and you can just kind of lay it down on the patient. This will need to be cleaned in the room. Wipe it down, and then it'll go back in a bag. Wiping it down should clean it, but I wouldn't handle it without gloves afterwards. We're in here. You're going to be using it for COVID positive patients for the most part, and you can even use it on non-COVID patients. But wipe it down maybe before and after every use. We're going to have a big ventilator bag, I believe, that it'll fit in. The regular trash bags, it won't fit quite right. Any questions?
Doing compressions, is it able to, like, can we still kind of position the patient? I know it's going to be a little
bit tight. So, ideally, with the COVID patients, you really want them intubated, but if you can, do compressions. If you started doing compressions, this is going to come flying off. Right, unless you really secure it down with like arm restraints, tie it down to the bed. This is going to get in your way for compressions. I mean, you can always back it up, but then you're going to be hanging off the bed unless the patient gets scooted down the bed. So yeah, the idea would be hopefully get them intubated before you have to do compressions. Once they're intubated, then it's not that big of a